On behalf of everyone at CIL of Northwest Florida and the Southeast ADA Center, I'd like to welcome everyone this afternoon and thank you for attending this webinar, part one of the ADA Basics. There are a few housekeeping items to go over before we begin this presentation. The webinar is being recorded and will be posted on our website for future viewing. So if you have someone who would like this information, be sure to share it with them. You can access the closed caption and or the transcript. If you have that need, you can click that button and the closed caption will appear. If you need the transcript, it will print out for you. Participants will be muted throughout the webinar, but you can post your questions. If you have questions, you can put those questions in the Q&A box and we'll be monitoring those and we'll save those questions until the end of the presentation. You can also communicate with one another if you need to in the chat, but we are going to monitor those questions. And also want to remind everyone to join us for part two of this presentation of this series on June the 29th. Part two will be reasonable accommodation, and that will be at 1 o'clock Central, again on June the 29th. Before we begin our presentation, I just want to share a little bit about CIL and our mission. As you can see the slide, our mission at Center for Independent Living of Northwest Florida is to promote, educate, facilitate, and assist and advocate on behalf and for those people with disabilities in partnership with our communities to achieve their goals for independence. We serve 4 counties: Escambia, Santa Rosa, Okaloosa, and Walton. We have 5 core services, and these are in no order of importance: individual and system advocacy, information and referral, independent living skills training, peer counseling and mentoring, transition services for youth, as well as diversion for those who are diverting from nursing homes. Other programs and activities include the Assistive Technology Program, Amplified Telephone, FTRI, equipment loans at no charge to the consumer. We also have social and recreational activities and a support group. We also do education and trainings. And we are regional consultants for all 5 titles of the Americans with Disabilities Act. So without further ado, I'm going to turn it over to Cherie Hoffman.
Okay, good afternoon, everyone. This is Cherie. The Southeast ADA Center is funded by the U.S. Department of Health and Human Services under the Administration for Community Living and the National Institute on Disability, Independent Living, and Rehabilitation Research. The Southeast ADA Center or NIDLR are not responsible for enforcement of the ADA. On this slide, there is a picture of the United States of a multicolored map of the 10 regional ADA centers. There are 2,200 affiliates on the local, state, and regional level for the Southeast ADA Center. Next slide. As I said earlier, the ADA National Network has 10 regional ADA centers. Each of these centers provides information, informal guidance, training, and resources for businesses and service providers. Also provide the information on the ADA in order to make it possible for everyone with a disability to live a life of freedom and equality. Next slide. Today we're going to stick to the basics. This webinar is an introduction to the ADA of 1990 to help increase your knowledge and understanding of just the basics of the ADA. Next slide. On this slide, there's a picture of President Bush with Evan Kemp, who was then the director of the EEOC, Reverend Harold Wilkie, Sandra Perino of the National Council on Disabilities, and Justin Dart. Justin Dart said at the signing of the ADA that the ADA is a civil rights act of the future. And we've been saying that for about 32 years now. And President Bush has said, let the shameful wall of exclusion finally come tumbling down. Next slide. In this, there's a description of people, some using wheelchairs, some just sitting on the White House lawn. But this was the law that went into signing in 2008, the ADA Amendments Act, the ADAAA, as we call it. It was an act that Congress decided that needed to amend the ADA of 1990 and how we should define disability. The ADA AAA was also a result of collaboration between many employers, businesses, business interests, and disability groups. Next slide. So the ADA AAA, what they looked to get on this was to broaden the coverage to individuals where the courts had said that they were not disabled. In saying this, they said mitigating measures should not be considered. And what does that mean, mitigating measures? Let's just keep it pretty simple. Medications, for one, hearing aids. Medications being a big one. For instance, a person who might be a diabetic and uses insulin to control their diabetes, and they had some type of issue where they needed enforcement. And it came back saying because they took insulin to control their diabetes, the courts were ruling that they did not define as a person with a disability because of these mitigating measures. So therefore, the courts came back with the ADA AAA and said, but without these medications, they're still a person with a disability. Also, it strengthened and added a few more things, such as the major life activities, including major bodily functions to the immune system, digestive system, and also added some episodic or in remission that's now covered, but some extra added coverage within the ADA AAA. Next slide. So this is just a question that I'm going to throw out there and you can think it in your head. And so how many people with disabilities do you think currently live in the United States? Now keep in mind, this is a qualitative, definitely people that have raised their hand and said, yes, I'm a person with a disability. So it's not all probably correct in its numbers, but it's what the CDC now says. Next slide. Is 61 million people, which at one time when the ADA came out, I don't know if you ever heard somebody say that it was 1 in 5 adults who live with a disability, but as of now, they're saying it's 1 in 4 adults who live with a disability. So they are saying that the disability impacts major life activities, and it was reported to the CDC. And I did do a little bit of further research with this, and it was coming into the same numbers with the Census Bureau as well. So the most common disability that most people think about and they see is mobility, right? Because it's a visible disability. They say mobility affects about 1 in 7 adults. And so at some point in our lives, we're all going to become a member of that group, right? We tell everybody that it's not a club that has a specific membership. Eventually, you're either going to age in place and become a person with a disability. You might be born with one, or you acquire one. So learning disabilities have been probably the most difficult to understand and get people to meet their needs within the system. Next slide. So here's the basics. The ADA has 5 titles. Now, when I go into this, I want all of you to understand something about the ADA. Just because you're a person with a disability doesn't mean that the ADA applies to every situation about a disability. The ADA is a legal term. It's a functional law, whereas other laws that are out there like Social Security or the Veterans Administration, any of these laws that cover disability in a more medical way are not, they define medically, where again, let's go with the ADA being in legal terms and functional terms. So under Title I, that covers employment. It prohibits disability discrimination in all the employment practices, and that's hiring, interviewing, on the job, special events, the lunchroom, for instance, the restrooms, only if it's a person with a disability that needs to access those activities within the building. So Title II is accessibility in public entities. Public entities are state and local government. State and local government are viewed in their entirety. They are viewed to program access, physical and program accessibility in state and local government entities. I'm not going to go into a lot of details about this, but if you have questions down the road or later on, we're going to give you information where we can give you more information. So Title III is accessibility in businesses. And what is business? Unlike program accessibility, it is private businesses such as restaurants, hotels, stores, the Walmarts down the road, the Hampton Inn, private businesses. Title IV covers telecommunications, which is telephone and communication systems for the public. And there's a lot of information that's contained in that, but it certainly may fall under Title I of employment, under effective communication, but not under telephone or communication systems in the public. And Title V is an interesting addition to the ADA. It's miscellaneous, and it means everything that's not covered under the first 4 titles is probably covered under there somewhere under miscellaneous provisions, retaliation, coercion. In fact, the Southeast ADA centers were actually born in Title V of the ADA. Basically, when the president decided to sign the ADA into the act, he said that he wasn't going to have another Civil Rights Act law that came into law without somebody doing the training, somebody providing the guidance, somebody out there. And so along into that Title V came training and technical assistance, which are the ADA centers throughout the United States. Next slide. So who's covered and who must comply with the ADA? And it basically a very simple procedure. Entities with 15 or more employees are what cover the employment provisions. It doesn't cover the fact that you have a State Farm agency and you only have yourself and maybe 1 employee. It has nothing to do with business. Entities with 15 or more employees are what's covered under Title I of the ADA, and Title II specifically, who are viewed in their entirety, there is no such number. It's 1 employee. So public government agencies, regardless of whether they receive federal assistance, privately operated and owned commercial entities, like I said, for example, private schools, private colleges, banks, restaurants, and theaters, and the list is not exhaustive. There are a few exemptions under the ADA, and to this day, it's still not really clear as to why this was ever written in, but it's clear on how they're handled in most cases, in which the Southeast ADA Center can help you out if you have that question. But exempt are private clubs, and there are some rules behind it, and religious organizations and churches. So next slide. So Title I, employment protections. Title I requires that employers provide reasonable accommodations for applicants and employees with disabilities and prohibits discrimination on the basis of disability in all aspects. It is making sure that work sites are accessible, making sure that workstations are accessible, modifying schedules, providing services such as interpreters, the possibilities of modifying equipment and policies. Title I also has does regulate some medical examinations and inquiries as well. Next slide. So Title II, we talked about it. This is public entities and some transportation. It's state and local government. So under Title II, public services cannot deny services to people with disabilities or deny participation in programs or activities that are available to people without disabilities. That's a pretty big, bold statement, and there's really a whole lot more to it. Again, keep questions in your mind, ask them later or write them down, and we're going to provide you some contact information at the end. And in addition, in Title II, we're going to say public transportation systems, such as your public transit buses, must be accessible to individuals with disabilities. Now, that is in most cases true with everything, but again, public transportation systems have several other areas that they have to be accessible in, not just the ramp, but communication and the services and the program that they offer. Next slide. Title III, I think we get most of our calls with Title III, because Title III is definitely where the majority of you spend a lot of your days and a lot of your nights in. Your restaurants, your hotels, your grocery stores, your retail stores, your privately owned transportation systems, which could very possibly be your Ubers, your Lyfts. There are some private charter buses. They have a little bit more stretch of the road on accessibility, but there are some procedures that may have to be changed in order to have accessible transportation for one where it's not accessible for all. Next slide. So I kind of lumped this together because we talked about it earlier, this Title IV and Title V. Title IV is telecommunications. Telecommunications are companies that offer telephone service to the general public, which as time has really moved on, 711 has become a wonderful feature for individuals who are deaf and hard of hearing. Similarly, quite a few devices are sort of going to a dinosaur mode, and like the TTYs and the TDDs, and simply because the cell phone services have so much more to offer these days, and the captionings and the apps and the ability for an individual to actually use a video remote interpreting and video remote services through their cell phones and through their phones within their workstations as well. Oh, next slide. And I'm going to let Danny just take it away.
Thank you, Cherie. Now, for the next little bit, I want to share with you and put everything into some historical context. And I'm going to be sharing a lot of information with you that may not seem like it's very important, but it gives you a historical background of where the ADA came from and the seeds that were planted, and it will make you, hopefully this will make you much smarter, and maybe you can win some bets with your friends. So this question is, when was the Smith-Hughes Act passed? And it providing vocational rehabilitation for veterans with disabilities. And the answer is in 1917. The Smith-Hughes Act was passed to create a unified program in vocational rehabilitation that included responsibilities for veterans with disabilities from World War I. So interestingly enough, the significance of this legislation and subsequent legislation happened in World War I. So the next question is, what was the 1927 Buck versus Bell Supreme Court decision? And the correct answer is that it ruled on forced sterilization of people with disabilities was not against their constitutional rights. And this question brought in the question, the focus focuses on the fact that the general public has not always been supportive of how and when people with disabilities should be involved in their communities. As we were passing legislation to ensure that service members with disabilities would be reintegrated with society, we were also trying to move beyond the damaging result of eugenics, or the Eugenics Movement, which is based on the idea that anyone who does not meet with society's definition of normal, quote unquote, should be separated from society and not allowed to have children. The Eugenics Movement maintained that people with disabilities represented flawed genetic stock and should be removed from human gene stock and should be removed from the gene pool through sterilization. So in 1927, forced sterilization of people with disabilities was upheld by the Supreme Court, and as the slide says, it was ruled not against people with disabilities' constitutional rights. So we have definitely come a long way. Now, for those of you who don't know who Ed Roberts is, Ed Roberts, seen here, is considered the father of the disability movement. And the question is, when did Ed Roberts finally gain admission to the University of California after winning his lawsuit? And the answer is 1962. So we said he is the founder of the independent living movement. He had to sue to gain admission to college. The University of California refused to admit him as a student, despite the fact that he was fully qualified, maintaining that his refusal was for his own good. College admission officials maintained that it would not be safe for Mr. Roberts to attend college. Next question, when was the Rehabilitation Act passed, prohibiting disability discrimination in federal programs and services? And the correct answer is 1973. The Rehabilitation Act was originally passed by Congress in 1972, but was vetoed by then President Nixon. The original Rehabilitation Act prohibited discrimination in the federal government, but not in society as a whole. This legislation was important because it laid the groundwork for the ADA. You see this slide? This was the longest sit-in ever conducted at a US federal building in 1977 when people were protesting. The US Secretary of Health, Education, Welfare refused to sign the regulations for the Rehabilitation Act. This was important because without the signature, the regulations the regulations, this law was not enforced. So most people don't even realize that people with disabilities have been involved in a significant civil rights movement in our country. So we're getting ready to celebrate the anniversary of the ADA, or the Americans with Disabilities Act, 32 years in July. It was passed, of course, on July the 26th. So we're talking now about the ADA, and it got strengthened in 2008 when the ADA Amendments Act was passed in response to several Supreme Court decisions that weakened the law. And the reason it was weak was because it narrowed the restrictions on who could be given the protections of the law. Now, this is just a legislative timeline of everything that we've been talking about, or most of the things that we've been talking about. And you'll notice in 1964 was the beginning of the civil rights movement that everyone knows and everyone talks about, but it did not include, in 1964, it did not include people with disabilities. One of the things that I'd like to mention to you, and the things that we didn't touch on, and draw your attention to, is the Fair Housing Amendment, making sure that housing things are accessible for people with disabilities, and also the Carrier Act. The Carrier Act made sure that air travel was accessible for those people with disabilities. So who has rights under the ADA? The ADA applies to people who have a disability, have a record of, or regarded as having a disability, or have an association with a person with a disability. So that is a pretty broad spectrum of people. So what is a disability? The actual definition is a physical or mental impairment that substantially limits one or more major life activity. So does the ADA apply? And that is a question, because as Cherie had mentioned earlier, just because a person has a disability doesn't mean that it applies in every situation for everyone. This is just a reminder of the 5 titles. Title 1 is employment, and of course it prohibits disability discrimination in all employment processes, and that goes from the hiring process, the interview process, the hiring process, all the way through the employment process. Title 2 is accessibility in public entities. Keep in mind that that is physical in nature and also program accessibility in state and local government entities. Title 3 applies to accessibility in businesses. Title 4 is telecommunication, telephone and communication systems for the public. And again, Title 5, miscellaneous. I'll leave that up there in case you want to memorize those for just a moment. Okay, so now we're going to do some practical application, because it's one thing to talk about the ADA and talk about the rules and the laws, and people's eyes kind of glaze over and they kind of lose interest. But when we put it into proper context, it gives you an opportunity to really look at it and apply it in a personal way. So I'm going to turn it over to Cherie and let her do that for you.
Well, thank you, Danny, and feel free to pipe in anytime, Danny, when I'm asking these questions if you'd like to add some things. As Danny said, we're just going to give you some practical applications, and of course, we just touched on the basics. So the practical applications could connect the dots for you, and if it does, that's grand. If it doesn't, again, we're going to give you information on how you can ask us questions later on down the road. So the first one I have here is Naomi applies for a job. So Naomi has a hearing loss and is applying for a job at a large department store. While completing the application, she discovers there's a question asking if she has a disability. Is this situation covered under the ADA? If so, under which title is it covered? Well, I'll give you about 2 more seconds to think that over, and I'm just going to come right out with most of these and just apply those applications for you. The answer is yes, this situation is covered under Title I, the employment provisions. So under the ADA, employers are not allowed to ask job applicants if they have a disability or any questions that would require them to disclose a disability, a possible disability, or even a health condition. Employers may ask, are you able to perform the essential functions of the job with or without reasonable accommodation? This question calls for a simple yes or no response. Job applicants who believe they will be able to do the essential functions of a job, even if they require an accommodation later down the road, could just answer appropriately and respond with a yes. No discussion or disclosure of a disability is required until an accommodation request is being made. Now, I would like to say that if you're asking for an accommodation during interview, you're obviously going out for the disclosure. And when a job is offered to you later down the road, if there are medical provisions and it's necessary for job necessity, there's going to be some times when disclosure might become a part of this process. But again, that gets a little deeper into this Q&A. Next slide. So this one I call Nina and the Bus. Nina is an individual who is blind, and she uses her city's fixed route bus system. She's frustrated because the bus drivers do not consistently announce the bus stops. This makes it more difficult for Nina to independently find her way to her destinations. Is this situation covered under the ADA? And if so, under which title is it covered? So the answer to this question is yes, and it's covered under Title II. I use the word city's fixed bus route system, so that means it's state and local government. So Title II of the ADA concerns programs and services that are offered by state or local municipalities. Public transportation is one of them that is covered. While the DOJ enforces Title II in most situations, in this case, it could also be the Department of Transportation who oversees the implementation of the ADA as well as transportation. Next slide. So Danny goes to the restaurant. Daniel went to a popular restaurant. Daniel's blind and unable to read the menu. When the server offered Daniel a menu, he declined and asked the server instead to verbally describe the menu options. The server said, "It's all on the menu," dropped the menu on the table and stepped away. Is this situation covered under the ADA? And if so, what title is it covered under? So I'm going to go right into this one. It's definitely covered under the ADA. And it's covered under Title III of the ADA because it's one of the 12 types of establishments that's referred to as places of public accommodation under this law. Businesses that serve the public must ensure that the goods and services they provide are accessible to customers with disabilities, even when the disability is not obvious, like in Daniel's case with a vision loss. Now, I'm going to go way out there really quick and kind of go and blow your mind. But let's say Daniel goes to a restaurant with his wife one night, and it's a romantic restaurant with ambience and low lighting, but Daniel's only a person with a vision loss, but he says to the waiter, I need for you to turn the lights up so I can read the menu. This is going to go into something a little bit more definitive with the ADA, which we call defenses. And actually the restaurant in this case would be able to say to Daniel that this restaurant, the ambience of this restaurant is to keep the lights low, but he could provide maybe a pen light or a small flashlight to Daniel to be able to see the menu. So we come up with these questions all the time, and then we come up with the what ifs. So next slide. So Rodney and his real estate broker license. Rodney, an individual with a moderate learning disability, and is starting a class to obtain a real estate broker license with a private company. When he attends the first class, Rodney discovers that he may need more time for the testing. He asks if he could have time for the added time for his testing. The company that offers the class refuses to provide this request. Is this situation covered under the ADA? And if so, what title is it covered? And as I said earlier, Title III is one that gets a lot of questions asked with the Southeast ADA. So this one is definitely a Title III as well. This is a private business that offers educational testing and offers goods and service to the public, and it must be in accessible format. In situations in which the accommodations are needed, a business may require individuals with disabilities to request these accommodations in advance. They could also ask for substantiating documentation on a disability. And any policy must be reasonable. For instance, they must, in Daniel's case, it would be better to ask 24 or 48 hours in advance, but it would also be better to ask prior to Daniel actually starting the class and getting there and realizing that he's going to need a longer period of time for testing. And also, it probably for businesses that might be on the lines today, clearly indicated on any promotional materials, flyers, websites, registration forms, anything that concerns the course that an individual may be taking. Next slide. Now, this is something that's always been a question in a lot of people's mind is like, who enforces the ADA? And you're going to be surprised with this answer because not every agency, not one agency enforces every title of the ADA. So under Title I of the ADA, which is employment discrimination, the U.S. Equal Opportunity Commission is who enforces that law. There are cases where people have sent their EEO complaints to the Department of Justice, but the Department of Justice turns around and sends them to the EEOC, which is the Equal Employment Opportunity Commission. ADA Title II and Title III complaints are enforced by the Department of Justice. And they may be filed on the Department of Justice website, which is ada.gov. They now have a beta online system, and violations may be filed on that online. They can be mailed. You cannot call and make a complaint. It can be faxed, filed, it could be faxed, it can be done online, or it can be mailed. I will always suggest the last sentence. In certain situations, it's important to consider mediation. The Department of Justice has a actually very broad mediation program that's sponsored by their department. Next slide. So Title IV of the ADA, the Telecommunications Relay, is enforced by the FCC. And Title V, which is the miscellaneous provisions, is more than likely going to be filed with the Department of Justice. It can be referred to other agency. It's just going to be one of those, we love to call it in our line of work, it depends. Next slide. So on the next two slides, all I've done is kind of, and we can have these slides sent to you if you need them, the resources such as the CIO of Northwest Florida, the Southeast ADA Center, the Department of Justice. Next slide. The Equal Employment Opportunity Commission, the FCC, as I said earlier, the Federal Communications Commission. There's also a great guide out there that really guides you through the disability rights laws, and it's titled A Guide to the Disability Rights Law. And right now, for those of you that are in the planning stages of your 32nd ADA anniversary, there is the adaanniversary.org website that has everything from logos to press releases to resources available that you can hand out at events. If you have any questions about that, again, we are going to lead you to the water for that one. So next slide. I'm not even sure, but do we have any questions, Chris?
No, ma'am, not at this time. Does not seem like we have any questions. You were very thorough.
That must mean that we did a good job, right?
Right. That's right.
So
next slide, Danny.
I did want to mention also, going back to what Cherie was talking about with all of the different laws and actual practical application of the law and different scenarios. It's not our intention to ever beat an organization over the head or a business over the head or confront them in a confrontational way about the law. There's a time and a place for that. What the CIL of Northwest Florida would rather do is partner with those organizations and businesses to educate those in positions of management and ownership and to help them and partner with them to make their business as accessible as possible for all people with disabilities. Because as a person with a disability, working with an organization that represents people with disabilities, we work and we live and we pay our taxes in our communities. So we want to enjoy those businesses as well. We want to go in and spend our money. We want to go in and create memories. So we don't ever look at it like we're gonna go over here and confront this business owner and shame them into doing the right thing. I think sometimes there is a time and a place for litigation. There's a time and a place for protests. There's a time and a place for those type of things. But our goal is to work together with them and to create a stronger community bond with those businesses and agencies and government entities, to let them know that we're here and that we're not going anywhere. And I'm sure Cherie would say the same thing.
Well, let me piggyback on that, Danny, because that is really well said. And the Southeast ADA Center is not an enforcement agency either. And unlike the CIL that can advocate and can give you a little bit more hand-holding and be able to contact the business on your behalf or, have a meeting with a business, the Southeast ADA Center does not do that. We are specifically in place to provide informal guidance. We don't hold the force of the law. We're not going to call an agency on your behalf. We're not going to review legal paperwork. Everybody has a little bit of the mission. And I will say that the CIL of Northwest Florida, ever since the Southeast ADA's inception, since Southeast ADA Center has been born, the CIL of Northwest Florida has been an affiliate and been one of the strongest affiliates in the state to assist individuals through mediations, through advocacy, through just the basics, like Danny said. And so that's what we're here for. And it's kind of, it makes your head just kind of say, well, who do I call? Who do I call first? Always call the SIL first. And if they're stuck, they're going to call us, or they're going to give you our number and say, call them. That's what we're here for.
Exactly. And we welcome that. And it's important that we keep that line of communication open with the community and whatever questions you have. So in order to contact us, you can contact me, Danny Broxson, at my email address if you'd like. It's Danny, DANNY, at CILNWF.org. Of course, we are located at 3600 North Pace Boulevard. Our phone number, 850-595-5566. And if you're not sure who you need to talk to, you can let our receptionist know and she can get you plugged in with the right person. You can also contact us through email. If you don't feel like emailing me directly, you can email the center, and then the email will get to the right person as well. You can email us at info@cilnwf.org. Of course, if you want to look at our website and see what we're all about, what we're doing, archived webinars, you can check out our website at cilnwf.org. You can follow us on Facebook, and of course, you can text. If you'd like to support what we do and be a part of what we do, you can text Give CIL to 44-321 to donate. So if you're inclined to do that, we would love to support. What we do is important to all people with disabilities and their families and their caregivers. And if you want to be a part of that mission, of course, we welcome that. I'm grateful that you have spent the afternoon with us. And if you have questions and you think of things later on, you're always welcome to contact us. We'll be glad to answer those questions or find the answer to those questions for you. Again, I want to remind you as we close today that part 2 of this ADA Basics will be on June the 29th at 1 o'clock Central. And part 2 will cover reasonable accommodations. We hope you've enjoyed this website or this webinar, and we thank you for your time and look forward to seeing you again in the future. Thank you.